In most first world countries today, maternal mortality rates are incredibly low. In places like Italy, there are 9 maternal deaths per 100,000 births. But it hasn't always been this way. Thanks to the work of a number of researchers across the world, those rates have dropped astronomically over the past 2 centuries. A key player in this development was Dr. Oliver Wendell Holmes Sr. Born in 1809 in Cambridge, Massachusetts, Dr. Holmes attended Harvard University, where he studied law for a year before switching to medicine. After Harvard, he attended Paris Medical School, which at the time was considered the Mecca of medical research and education. In Paris, Dr. Holmes studied under the renowned Pierre Louis, a pioneer in statistical analysis whose famous study of bloodletting in 77 patients helped to disprove the efficacy of bloodletting. In the public health field, Dr. Holmes' most impactful research was done on puerperal fever, particularly how it was affecting maternal mortality rates. Maternal mortality rates were 10 to 20 times higher in hospitals than in births attended by midwives at home in the mid-1800s. This was largely due to puerperal fever. At the time, obstetricians would often perform autopsies of women who died of puerperal fever just hours before helping to deliver the children of healthy patients. In 1843, Dr. Holmes concluded that these physicians were bringing puerperal fever with them into the operating room and passing it on to their patients. He published his findings in a small medical journal, along with 8 recommendations for physicians on how to stop spreading the deadly infection to their patients. Unfortunately, the journal soon failed and his research was not widely known until years later. When his research was finally recognized, it was highly criticized by the medical community. In one instance, he was vigorously attacked by 2 leading obstetricians in Philadelphia. It took several years and the publications of researchers such as Semmelweis, Lister, and Pasteur to finally convince the medical community of the validity of his findings. In addition to his work on puerperal fever, Dr. Holmes is also known for his support of medical reform and advancement in other spheres. As a young doctor, he founded the Boston Society for Medical Improvement to encourage continual research and development of the field. As Dean of Harvard Medical College, he taught his students to use empirical data and facts as the basis for treatment, rather than traditional practices. He coined the term anesthesia in 1846. Holmes also believed that doctors overused medication and advocated for methods that involved more natural, holistic approaches to healing and health. Although his work is largely forgotten, Holmes' research and commentary has certainly had a considerable impact on public health.